Hi, everyone. My name is Ananda, and welcome to our workshop today on the topic of breastfeeding. We're going to take an entirely new approach to nursing a baby. We're going to incorporate the mind-body connection, and this is part of a series hosted by Boston Doula Circle that we will be doing on an ongoing basis. So thank you so much for joining us today. We're going to be talking about the topic of pain while breastfeeding or nursing, and we'd like to acknowledge it, and we'd like to talk about how to prevent it and how to resolve it. I'm the director of Boston Doula Circle. I'm also the co-author of the Doula Guide to Birth, published by Penguin Random House. And I was first trained as a certified lactation counselor in 2001. So I'm going into my 21st year of being a lactation specialist, and I'm so happy that you're here today. I'm also joined today by my guest, Valerie, who is currently a nursing parent and who will be sharing her experiences with us a little bit later today. So the way that we're going to go forward is that everyone who is watching live is going to be muted except for myself and Valerie. But we'd love to hear from you, so please put any questions and comments that you have into our chat box here on Zoom. And in fact, I'm going to ask if it looks like everybody is muted. If you're not, go ahead and mute yourselves. And I'd also like to say that if you're joining us with your baby, if your baby has been born recently, you'll be invited to do some activities with your baby during our workshop. If your baby is not here, then I'd like to ask you to get a hold of a prop that you can use in place of a baby, and that could be a doll or a stuffed animal that's about 12 to 16 inches long. So I'll show you what I have here. We'd like something that's about the size of a real baby. And if you don't have that, you could actually grab something else to stand in for your baby. So for example, I often will use a bath towel, and I'm just going to roll that up into a tube shape like so. And this can stand in for my baby now. So I'd like you to have something to represent your baby so that you can do these activities with us. And if we have any other major technical difficulties today, if Zoom were to crash, then I'm going to ask folks to hang in there with us and give us about 5 minutes, come back to the meeting, and hopefully we'll be able to start up again. So I'd like to say a little bit about why we're here today. The approach that we're taking in this series of workshops, as I said, is to think about nursing a baby more as a mind-body experience and a bit less as a technical procedure. And as human beings, we can use both of these approaches. Both of these approaches are needed and helpful. But in today's world, the use of body awareness can be almost entirely forgotten when lactation skills are taught. And when we come back to things such as the mind-body connection, body awareness, and recognizing the fact that even a newborn baby is communicating in so many ways with their nursing parent. By coming back to these kinds of principles, we can find solutions to a lot of the lactation problems that have become so common, but that don't need to be so common. So That's the basis to our approach. As we get started today, if you are watching this live, I'd like to ask you to share some things in our chat box. So let me just bring up my screen. Okay. We had a moment at the beginning where we had to start over, so I apologize for the delay here. Okay, so here are the questions I want to ask folks to share in our chat box. One is that I'd like to ask you to think about what you have heard regarding the topic of nursing a baby and pain. So for example, have you heard that nursing is supposed to be painful for the first several weeks or months of your baby's life? Or have you heard that nursing is not supposed to be painful? And if it is, you're doing something wrong. Please share some of your answers to this question in our chat box here on Zoom. I'd like to hear what people have heard or what your own beliefs are at this point in your journey. And you can also let us know if you've, question number 2, if you have experienced pain while nursing, how would you describe that pain? For example, would you say that your nipples felt pinched, that the baby seemed to be biting? Did the entire breast hurt? Or is there some other way that you describe it? So I want to invite people to answer those questions, and I'm going to give a few minutes to do that. I'm also going to check in right now with Valerie. I'm pretty sure that I can see Valerie. Looks like she'll be ready to join us and speak in about 10 minutes. I just wanted to double check if that's going to work out for you, Valerie, or if you need you'll need to change the timing of that.
That should work, Ananda. Thank you.
Thank you. Okay. So we'll take a look at the answers that folks have shared. Please, please continue to drop your answers into the chat box. Even if someone else has given your answer already, go ahead and share that with us so that we can, I'd love to just get a sense of what people are coming into this space with. And actually I'm going to go ahead and start to read a few of these. Someone says, still hearing that you will more than likely experience pain, but it will subside in a couple of weeks. And someone else says, my daughter's mother-in-law insists on telling everyone that if it doesn't hurt a lot, then you aren't doing it right. That one I haven't heard it put exactly that way. That does sound fairly harsh. Someone else says, I've heard that if nursing is painful, then you aren't doing it right. And that was really demoralizing to hear. Nursing is not supposed to hurt, but many women say that when the baby latches, it hurt and then the pain goes away. And we're going to look at a couple more of these. I've heard that it's normal to have some pain until your breast toughens up. And I experienced that pain in the first few weeks. The pain was mainly on the nipple It was a chafed raw pain that began when nursing started and would get better during the session. And again, if folks have other answers, please keep adding them, and we're going to refer back to this. And it looks like those of you watching live have heard a variety of different opinions on the topic of pain. And so we're going to address, as we keep going today, what really is normal, what is to be expected, and why is it that we're hearing these different opinions. So feel free to continue to share anything you'd like in our chat box. What we're going to do for now, though, before we get back to that, is we're going to start out with something like a guided meditation. And if you've been with me before, you've done something like this in the past. And we're going to be thinking about the topic of how we hold our babies. And you may have heard me talk about why this is important. What I'd like us to do is for now, I'd like us to separate the act of holding your baby from the act of nursing. And in reality, we cannot separate those two things, but we're going to tease them apart just for now so that we can see how one affects the other. We'll be cultivating an awareness of how we hold our babies, and we'll take away the pressure of having to nurse at the same time. So you're going to be doing this activity with your real baby, or with your doll, or with the towel, whatever it is that you have. So I'll give you a moment to pick up your baby right now, if you're not already holding your baby. And if you have your real baby with you, it's fine if your baby is awake or asleep for this activity. And I'm also going to ask you to remove any pillows or boppies from your lap if you've got those sort of things with you, because I'd like you to be in full contact with your baby's body, and there won't be an object between your body and the baby. It's fine if your baby is clothed. I just would like you to remove any pillows or swaddles if you can. We're not planning to nurse right now. But if your baby does need to breastfeed or bottle feed at any point, you can go ahead and do that. Otherwise, we're just going to be focusing on how we hold our babies. So in our last workshop, I asked folks to hold your baby in whatever position you wanted. And this time we're going to start out with an upright position for your baby. And let's have your baby facing your body. So if I have my baby upright and facing me, there are a variety of ways that you could do this. Feel free to take a look at the screen. I could have my baby sitting all the way down on my lap, facing me. If it's a newborn baby, sitting upright often means that the baby is slouched a bit, and that's fine. A newborn is not going to have muscle control to sit straight upright, but we still want the baby to be generally in a vertical position and facing you. Or instead of your lap, you might be holding your baby higher up on your torso. So your baby could be on the left side of your torso, on the right side of your torso, or your baby could be right between your breasts. So any of these positions are fine. Just going to ask you to hold your baby in an upright position. And now I'd like to ask folks to notice your own posture. As we keep going, you can have your eyes open or closed, whichever's most relaxing for you. You might want to look at the screen now and then, but it's also fine to have your eyes closed as we go into a state of relaxation. So notice your own posture. Are you sitting straight upright? Or are you leaning forward a bit? Are you leaning back and reclined slightly? Or are you very reclined? Is there an adjustment that you can make so that your posture is as comfortable as possible? With your baby in an upright position on your body, if you're reclined slightly, would you like to recline a lot more and take your baby with you? So that you might be almost lying on your back. I'd like you to make whatever adjustments you need in order for your posture to be the most relaxed and comfortable as you're holding your baby. And now I'd like you to notice how your baby feels in your arms. Does your baby feel stable in this upright position? Do you need to shift your baby an inch or two higher or lower? Do you need to shift your baby a bit to the right or the left? Would you feel more stable if your baby was on a diagonal across your chest or torso rather than completely upright? And at the point where your baby's body makes contact with your body at that physical place, does it feel pleasurable or enjoyable to have your baby's weight leaning on you? Notice the sensations in your body. And now I'd like you to think back to the moments right after your baby was born. What happened in those moments? Did someone hand your baby to you and place your baby on your body for you? So this would be the first time that you held your baby. And for some people, they are able to hold their babies right away. For some people, there may have been a separation. So we're thinking about that first moment when you were actually able to hold your baby without interruption. So did someone hand you your baby, or did you have the opportunity to reach for your baby? And in that case, did you choose your own position for holding your baby? In those first few days of your baby's life, what was it like each time someone handed your baby to you? Was your baby mostly unclothed so that you could be skin to skin? Was your baby clothed and swaddled when someone handed the baby to you? Did someone place a pillow or a boppy under your baby when you were holding the baby? Were you nervous or relaxed the first time you held your baby? Did you become more confident holding your baby as the first few days went by? And right now, although we're not holding our babies for feeding, I'd like you to think about what it's like when you nurse. When you nurse, are you wearing, what are you wearing? Are you wearing a bra, a shirt, or nothing at all on your chest? When you nurse, is your baby usually unclothed? Is your baby clothed? Is your baby swaddled or unswaddled when you nurse? Are your baby's hands uncovered? Does your baby have little gloves on? Does your baby use a kneading motion on your breast with their hands? Does your baby press his hand into his mouth before latching? Do you try to hold your baby's hands away from the breast while nursing? Do you typically have a pillow or boppy under your baby, or do you have full contact with the baby's body and no pillow between you? Does the beginning of a nursing session feel slow and relaxed, allowing the baby to take their time? Does your posture feel relaxed when you nurse? Do your arms and hands feel relaxed so that you're not using arm strength to lift your baby? Do you make use of any devices at the breast, such as a nipple shield or a tube that's part of a supplemental feeding system? Do you ever nurse in a lying down position so that you can get rest? What position is the most relaxed for you to nurse in? I'd also like to ask you to notice any physical impulses that your baby is having right now. Is your baby stretching? Is she repositioning herself? Is she opening her mouth and rooting for your breast? If your baby's eyes are closed, are their eyeballs still and peaceful under the eyelids? Or are they having rapid eye movements? There's a whole world of sensations happening inside your baby at the same time that you are experiencing sensations in your own body. So let yourself settle into this awareness of how your body feels and how your baby's body feels to you right in this moment. And just settle into that awareness and that sense of relaxation that I hope you'll be able to feel. And then bring your awareness back to the room that you're in. And for now, this will conclude the meditation that we just did. So now that we've had the chance to relax together, we are going to shift our focus a bit. And now we'll start talking about the topic of pain while nursing. And when pain occurs, it's not relaxing, but our goal will be to resolve pain that might be occurring so that we can achieve that wonderful state of relaxation when we feed our babies. And one of the things we'd like to do in today's session is to acknowledge that people do sometimes experience pain while nursing. We want to recognize and validate what people have experienced. And we also want to recognize that many women report that they feel their pain has been dismissed by other people. So, so all of that we want to acknowledge and bring that into the room. We don't want to dismiss the fact that some people have reported pain. And right now, I'd love to ask my guest, Valerie, to come in and join us and share some of her story with you, which is going to include her experience with this particular topic. So Valerie, you can come on in and unmute yourself.
Thanks, Ananda. Can you hear me?
Yes.
Great. Hi, everybody. Happy to be here today. As Ananda said, I'm Valerie, and I had my baby, my first baby, Lila, at the end of October last year. So she's just about 4 months old. I am just getting over a cold, so my apologies in advance for scratchy voice or any errant coughs that come out of me. So I offered to tell my story of our breastfeeding journey because I did experience quite a bit of pain from breastfeeding, and I hope that sharing my story might help somebody else. Leading up to Lila's birth, I spent a lot of time preparing for the birthing experience, but I now realize that I could have benefited from spending a bit more time preparing for what was to come afterward. I did, however, take one of the free Zoom classes focused on nursing that was offered by the Boston Doula Circle, which is where I first was acquainted with Ananda. Lila was born 2 weeks late, and she came into the world really hungry. So much so that before we figured out latching, she chomped down on both of my nipples very hard, and I was left with deep fissures on either side of both of my nipples. These injuries ended up taking 13 weeks to completely heal. In addition to immediately getting these injuries, I was struggling with low milk supply. So in the first weeks of having Lila, I had a fussy baby because she was hungry all the time. Of course, one of the solutions for low supply is to latch as much as possible. And in my situation, that meant subjecting myself to pain on pretty much around the clock. And another solution is to pump to increase supply. But because of the placement of the injuries that I had, pumping was also quite painful. I also retrospectively learned that I was using much too aggressive settings on my pump, which was causing additional pain on my nipples. And in addition to all these issues with pain in my nipples, I was experiencing a burning sensation inside my breasts. I never figured out what that was, although I have a guess. And it eventually just went away on its own. But I thought it was worth mentioning kind of to frame my experience. So for about 2 or 3 weeks after she was born, I was experiencing this pain and I was just kind of pushing through it to try to get my supply up and to feed my little girl. But I was also spending a lot of my days crying and feeling like breastfeeding wasn't for me. To try to get some help, I saw a lactation consultant at our pediatrician's office. At that visit, we did a weighted feed, which is where they weigh the baby, then you feed the baby, then you weigh them again so you can figure out how much milk the baby took in. And they told me that the latch looked good and suggested supplementing with formula and sent me home with a prescription nipple cream. I also had my OB look at my nipple injuries at one of the follow-up appointments. And similarly, they offered prescription nipple cream and suggested that I keep going for as long as I could take the pain. Both of these experiences left me feeling like the options were to continue experiencing the same level of pain or to stop breastfeeding. At that point, we did start supplementing with formula, which satiated Lila, and she was happier, which was good, but that wasn't ultimately what I wanted, and it didn't help my supply issues because then she was latching on less. After those appointments, I reached a moment which was kind of a breaking point for me. It was the middle of the night. I was trying to breastfeed Lila and experiencing a lot of pain. I was probably really tired, as new moms are. And I just wasn't sure that I could continue doing this. I desperately wanted to breastfeed my baby. That was really important to me. I wanted to experience that wonderful bonding that you hear about, but I couldn't see a way out of that. And in a last-ditch effort, I remembered Ananda from that class we took, and I sent her an email, and I actually looked this up yesterday. It was at 3:36 a.m. on November 27th. So middle of the night. Oh, there's my little baby girl and my husband. Are you guys good? Yeah. Okay. So it was middle of the night. I was just really feeling it. And I sent this email seeing if maybe she could help me. And she promptly emailed me back the next day and we set up a time to virtually meet. Once Ananda had enough information about her situation, had asked me what was going on and explored through questions, she began to troubleshoot ideas with me on how to both increase my supply and address the pain I was experiencing. And that was really the first time anyone I'd reached out to actually was addressing the pain as something that we could try to correct rather than just power through. And I think that act alone helped me so much just to have it acknowledged. But the process was iterative. In the interest of time, I'm going to kind of summarize. And so what ended up working for me was using breast compressions to increase the supply. And breast compressions didn't add any pain, which was great. Using the lowest settings on my pump when pumping, which reduced the amount of pain I had from pumping, putting nipple cream on before breastfeeding, and pumping to reduce the pain, exposing my nipples to air as much as possible, which I think helped aid the healing process, switching positions to ones that didn't pull on or rub on the injuries as much, and then finally adopting a growth mindset. And what I mean by this is that I was focusing so hard on what I couldn't do and that I wasn't recognizing any incremental improvement or any small wins. And I think that original mindset I had really made me feel disconnected from my baby. Once I started celebrating the incremental wins and kind of thinking of the experience of what was going on as me and Lila doing this together, I I really started to kind of find the joy in it and see a path forward. Some of those incremental wins, well, a big one was when we finally got off formula, but the incremental ones could have been something like we had one good breastfeeding session in a day. So the list of what worked for me makes it sound kind of smooth, but the path to correcting these issues were bumpy. It included a lot of trial and error and some ridiculous temporary efforts. Like I had mentioned, the positions. There's one position that worked was the sideline because it kind of took some of the pressure off the wounds I was having, but Lila would immediately spit up all the milk. And so I recognized that having her in that position would work, but she couldn't be lying down. She also didn't like being face down, kind of lying on me. So there was a couple of weeks where I was putting a bunch of pillows in my lap and setting her down and leaning over her. It wasn't the most ergonomic fix, but it worked for those couple of weeks and we were able to continue breastfeeding and move forward. So after about 8 weeks, I was able to get back to 100% breast milk. And by about 10 weeks, we were back to almost completely breastfeeding and only pumping when we wanted to, not because we needed to. And so today, Lila and I are in the groove and I think connected and confident that we can breastfeed with ease. And that feels really good. Of course, as all of you know who are parents, there are new challenges that pop up. And at 4 months, I'm navigating distracted eating, but I think that that's just parenting. And that's kind of a good lesson to learn too as a new mom. So I have 3 big takeaways from this experience that I wanted to share. The first is that although it's tough, know that you can be your own advocate to find solutions to succeed in what you want. Although it's not everybody's goal, and that's okay. It was important to me to breastfeed my baby. And so to get that support I needed, I had to seek out help from multiple sources until something worked for me. Secondly, reaching out to friends or your greater community is also really helpful. Pain with breastfeeding and low supply issues are very common, but they're not, at least in my experience, freely discussed. One thing that happened during all of this was my husband made an Instagram story about baking me lactation cookies. And that simple social media post resulted in a number of women, both women I knew well and some that I didn't, reaching out to me directly to discuss what was going on and offer support. And I got a lot of help from that, some practical, some more emotional. One of the women actually sent me a link to an article that was titled "When Breastfeeding is Hard," that discussed the emotional aspects of challenging breastfeeding experiences and introduced that growth mindset idea to me. And so that's my third point, is that growth mindset. Although breastfeeding is quote unquote natural, it can commonly be challenging and pain can be a component of that. And so everyone has their own struggles as they begin that steep learning curve of breastfeeding and parenting in general, but adopting that growth mindset to recognize small wins and incremental improvements rather than getting down about the experience not being what we imagined, and all of the feels that can come with that. You know, some people call it mom guilt or things like that. Really focusing on those wins and solutions forward can really light your path. So those are all the points I wanted to make for my story, and I'm really happy to take any questions if there are any.
Great, thank you so much, Valerie. And yes, any questions or comments can go into our chat box at any time. Okay. That was, I really appreciated hearing that story. Valerie mentioned an article called "When Breastfeeding is Hard," and that was published on the website kellymom.com, which is a wonderful source for breastfeeding information. It's organized something like an encyclopedia, and you can search, excuse me, for all kinds of topics on kellymom.com. And Valerie shared that article with me, and I was able to learn something. So after 20-something years in this profession, I'm happy to acknowledge that there's still more for me to learn, and for any professional in the field of maternal and child health. There's always more for us to learn. So if folks would like to look up that article, I highly recommend it, When Breastfeeding is Hard. And it was one of the best articles I've ever read on breastfeeding. And at the same time, what's funny is that on that same website, there was another article, and I don't recall the title, but it was by a different author who took a kind of the opposite approach and said that when breastfeeding is hard, sometimes we just need to do these things in sacrifice for our babies. And that was not the message of the first article. So even on the same website, we saw these two different messages, and excuse me, several people in our chat box continued to share what your experiences have been with different types of pain while nursing. And so just so important to acknowledge the pain. We're going to take the approach that breastfeeding is actually, when it comes to the question, is it supposed to hurt? The answer to that question is no, in the sense that the biological design of breastfeeding is not, it's not meant to hurt mothers who are human beings or mothers who are any other type of mammal. That's not the design. However, again, in today's world, it is common. We do hear many people reporting that they are experiencing pain, and we're gonna talk about why that is. But the biological design, excuse me, is not for there to be pain. So when it happens, let's start by acknowledging it. I'd like to also comment on the fact that there is a fairly large body of research showing that our medical professionals do have a tendency to dismiss pain when it's reported by female patients, as well as pain reported by patients of color. And of course, some patients are both female and patients of color. And reports of pain tend to be dismissed. So we have multiple studies showing us this at this point. And this can have very unfortunate consequences. And when this situation occurs, it's not because doctors are bad people at all, but it speaks to the larger society that we live in, which doesn't always take women and people of color seriously enough. And then that issue became embedded into healthcare. So just one example is that, for example, when women go to the emergency room, the research shows that they wait longer, a significantly longer amount of time to be seen than a male patient who arrives at an emergency room. And there's lots of studies which has looked at this in many different ways. And there is a lot that needs to happen in order to change this. From what I've seen, people in the medical field are starting to talk about this and hold themselves accountable. We still have a long way to go. We're doing our small part by being here today to talk about it. So in terms of pain while nursing, I'm going to say it's not normal, it's not part of the biological design, but it is common. So let's look at why that is. Valerie mentioned a lot of very important things. The most common cause of pain while nursing is that there's something about the baby's latch or positioning that we need to change. And when the baby's mouth is in the correct place to withdraw milk from the breast, the correct placement does not hurt. But while we're learning to find that correct placement, in those early days is often when injuries occur. So the good news is that babies have reflexes in their bodies that help them do their part to latch on. And it's been estimated that a baby has at least 200 reflexes in his or her body that assist the baby in latching on. So they're not just They don't just have reflexes in their mouth, which tell them to open the mouth and latch on. They've got reflexes up and down their entire body, which help them play their part in latching on. And for nursing parents, we have reflexes as well, but being adults, nursing for us is much more of a learned behavior. And we started learning long before we actually had our babies. We started learning what it means to feed a baby before our babies were even born. So a large component of learned behavior is visual learning, and meaning that we learn by seeing. However, when it comes to feeding a baby, if we go back almost 100 years, not quite 100 years, we go back to the 1930s, that was the time when we entered the first era in history, in all of history, when breastfeeding became hidden away, less than 100 years ago. Previous to that, we would have learned to nurse by seeing it on an everyday basis in many locations all around us. So this was true in cultures all over the world and time periods all throughout history. Nursing a baby was part of everyday life. It was done out in the open, and it was something that would be constantly seen by a person before they actually had a baby and needed to nurse themselves. What happened in the 1930s is that commercial formula manufacturers began heavily marketing their products for the first time. And this changed the landscape of how people fed their babies. One of the effects was that images that we had of people breastfeeding began to disappear. And otherwise, these images could be found easily. And by images, I mean artwork, sculptures, paintings, folk art, and in the early 1900s, there would have been photography as well. And if you attended my session last month, you saw a sampling of the images of nursing that were available all around the world. And this only changed in the last 100 years. So what we're going to do now is we're going to look at some modern images of people feeding babies by bottle and by breast, and we are going to do some visual learning together. Okay, so we're going to look at a few photographs, and we're going to ask the same questions for each of these photographs. And we're going to try to kind of dissect what are the, what the elements are of holding a baby for feeding. And this is we're partly going to be doing some kind of procedural learning here, but we're also going to be thinking about the fact that this information, it just gets absorbed by seeing it. So when it comes to the mind-body connection, our minds are learning to do what we see, even if we don't, study it in an academic way. So number one, we're going to look at what part of the parent's arm is the baby's head resting on. And here we have an image of someone feeding a baby by bottle, and the baby's head rests in the elbow area of the adult, and that's usually what we see when feeding by bottle. This placement does not actually work for breastfeeding, but it's one of the components that we often need to adjust when we're learning to breastfeed. Many people will put their babies out to the corner of their elbow when they're learning to breastfeed, again, because we visually learned how to do that in a subconscious way. That's what we've learned that feeding a baby means, but this placement actually does not work for breastfeeding. What's the angle of the baby's open mouth? It's a little bit hard to see, but if you were to get up really close, this baby's mouth opening is less than a 90-degree angle. Number three, is the baby's body closer to horizontal or vertical? This one is somewhere in between. The body is on a diagonal and the legs are horizontal. And that tends to be what we see with bottle feeding, is something that tends more towards horizontal positioning. Number 4 is baby's torso directly facing the parent or tilted away. And again, a little hard to see the baby's kind of torso in that little green outfit is blurs into the parent, but the baby is tilted away from the parent. The baby's torso is basically facing the ceiling. Number 5 is baby's forehead parallel with the front of baby's chest, or is the head tilted back? So this baby's forehead is slightly tilted back, but it's actually not tilted back to its full extension. It's pretty much lined up with the baby's torso. And then number 6, where's the baby's mouth in relation to the parent's nipple? And I can guess by looking that the baby's mouth is far above the nipple. It's not in the location it would need to be to latch on for breastfeeding. And that's something else we see very, very commonly, is that when new parents are holding their babies for breastfeeding, they'll often go automatically to a position where the baby's mouth is high up above the nipple. It's kind of overshooting the area that they want to get to, and it takes some conscious effort to realize that we need to drop the baby down much lower for breastfeeding than we do for bottle feeding. One more bottle feeding photo. Number 1, the baby's head is resting closer to the elbow than to the parent's hand. Number 2, the angle of the baby's mouth is smaller than 90 degrees. Number 3, the baby's body is closer to horizontal than vertical. Number 4, the baby's torso is tilted away from the parent. And number 5 is baby's forehead parallel with baby's chest, or tilted back. It's parallel. So if you look at take a line from the chin to the forehead, you could continue that line down the baby's body, and it kind of makes a straight line. Forehead to chin to the front of the body. We want the baby's head to actually be tilted much farther back for breastfeeding. It doesn't work with breastfeeding to have the baby's head in the alignment that we see here. And then number 6, where's the baby's mouth in relation to the parent's nipple? Again, it's overshooting the nipple. It's much higher than it would need to be if we were nursing. So now we're going to look at a couple of pictures of nursing and the positioning that works better for nursing. So for this one, number 1, we can't really answer that question. What part of the parent's arm is the baby's head resting on? We can't see that here. Number 2, what's the angle of baby's open mouth? In this one, it's more than 90 degrees. So I'm going to look closely. I'm going to say it's about 120 degrees. And for nursing, what needs to happen is that the baby's mouth needs to be wide open in order to take in the whole nipple and some of the breast tissue beyond the nipple. We don't want babies pinching down just on the tip of the nipple. We want babies to have a wide open mouth that really sucks in the breast tissue beyond the nipple, which is not a sensitive area. The nipple is very sensitive, but we want the baby to suck the nipple in deeply so that the nipple's not being pressed down upon by the front of the baby's mouth. It's going more deeply into the baby's mouth, and we're getting past the structure that's going to feel pain. So this baby's got that angle of more than 90 degrees that we need for breastfeeding. Is the baby, number 3, the baby's body is vertical in this picture. And many people don't know that vertical positioning is even a breastfeeding position, but it's probably the position that was used most commonly throughout history before bottle feeding became so prevalent and we switched to a horizontal position. Question 4, baby's torso is directly facing the parent. So this baby is pressed into the parent's torso, and they're basically chest to chest or tummy to tummy. Number 5 is baby's forehead parallel with the front of the baby's chest or tilted back. So if we were to draw a line here between the chin and the forehead, we see the baby's head tilting back. From chin to forehead, tilting back, and that's what allows the mouth to open. So we want to get that head tilted back. Again, that's something that often needs to be practiced over and over again when people are learning to nurse, because they don't realize that the head needs to tilt so far back. And then number 6, where is the baby's mouth in relation to the parent's nipple? Of course, it's lined up with the nipple. It's not overshooting the nipple. It's not hitting the higher part of the breast. And we'll look at just one more picture. Same thing here. We can answer question number 1. What part of the parent's arm is the baby's head resting on? Here it's resting on the wrist or the hand. It's not way out to the elbow. Number 2, the angle of the baby's mouth is more than 90 degrees. And this one here we probably have the most wide open mouth out of all the pictures that we've seen. So I'm going to call this like 150 degrees open wide. And that's happening because the baby's head is tilted so far back. Number 3 is baby's body closer to horizontal or vertical. It's about at a diagonal here, maybe slightly closer to vertical. Number 4, baby's torso is directly facing the parent. So again, they are tummy to tummy, pressed into each other, and that pressure on the abdomen sends a signal. It releases reflexes in the baby for the baby to open their mouth and latch properly. So pressure on the abdomen. We don't get that pressure on the abdomen when we turn a baby away from us to bottle feed, but for breastfeeding a newborn, we want the abdomen pressed into us. For an older baby, it's not so critical, but for the newborn baby, we want the baby fully turned toward the parent and pressure on the abdomen. Number 5, you can see the baby's head tilted back. So if we drew a line from the chin to the forehead, we see it. It's dropped back at a really, it's really extended almost as far back as it can go. And then number 6, baby's mouth in relation to the nipple is of course at the same level as the nipple. It's not overshooting the nipple from above. So what would be so helpful is if we could take our time and really study what correct latching looks like, the type of latching that results in a pain-free experience. If we could really stare at that and study it, that would be really helpful. And most of us need to make up for a lifetime of not being able to see successful nursing. So these images have not been available to us for our entire lifetimes for many of us, and we are kind of needing to make up for that. If you're watching this live, I'll be sending you a recording so that you can go back and look closely at these images. Or if you're watching this as a recording, you can pause the recording and look closely at the photos. And I'm going to share some resources now for ways to make it possible for us to have the experience of being able to see nursing, to have access to these visuals. And we're going to take a break right now, but I'll leave this up on the screen during our break. And these are some videos that I like. We've got more videos on our Boston Doula Circle YouTube channel. There are a couple of videos. One is from Amita and the other is from Lancino. Those are breast pump manufacturers. And they've got, each of those has created a great video with close-up views of latching. There are a few books with photographs of breastfeeding. I wish there were even more, but we do have at least these 3 books that I'm aware of. In particular, the last one, Breastfeeding with Comfort and Joy, is basically a picture book of breastfeeding that I highly recommend, just to be able to look at page after page after page of what are the characteristics that successful positioning have in common. And then when I also listed some groups. If you can join either a breastfeeding support group or even a general new parent support group where people meet in person, in those spaces, it's harder during the pandemic, but if you can find a way to do that, you'll see people nursing. So just to be around it as much as possible. If you can go to a group once a week. I used to lead groups, and sometimes we'd have 15 people in the room, and over the course of 2 hours, every single baby is going to need to eat. And I used to say to myself, you know, we're having a breastfeeding party when we would get together in these support groups, because you know, everyone feeds at some point, and it is a way to normalize it and to get a chance to see that. During the pandemic, this is a bit harder, but if you can get together with any new friends or new parents who are nursing, that's our chance to give each other that support. So I'm going to pause us for 5 minutes. It's 1 o'clock for those who are watching live, and let's come back at 1:05. Hi there, folks. We're going to come back together, and we're going to talk about some of the other issues that can cause pain while nursing. What we were just reviewing was the elements of latching and positioning that contribute so much to whether someone experiences comfort versus pain. That it tends to be the #1 cause of people experiencing pain, is the need to change something about the position, and sometimes it can be a very, very small change. So a person might be holding their baby in such a way that we need to move the baby's entire body, you know, perhaps one inch or even 1 centimeter, a really small distance. And that makes, that changes everything. And so I met a new parent about 20 years ago. We were working together, I was supporting her, and she told me that she had started using, she called it micro adjustments, to find the positioning that did not hurt. And I've used that word ever since, because it can really be something as small as less than 1 inch of adjusting the baby's body from left to, you know, a little bit further to the left, a little further to the right, a little further above or below. That's part of what we do when we're trying to correct a latch and find the best positioning. So really, that's one thing you can do, is take that time to make those micro adjustments every day until you get closer and closer to that pain-free positioning. And there are other causes of pain as well, so we're gonna talk about those. I'd like to share the screen again, and I'm going to talk for a moment about the use of boppies and nursing pillows. And on this topic, there's a lot more information in one of my previous workshops, if you were with us last month. So you can visit the YouTube page for Boston Doula Circle and look for our video, which is titled Breastfeeding: An Entirely New Approach. And that was the first workshop in this series, where I spent a lot more time talking about the use of pillows and boppies. But what I'll quickly say today is that although nursing pillows are comfortable for some people, they also appear to cause latching problems for many other people. And so we want to be aware of this. The reason this can happen is that they can actually cause problems, is that the pillow blocks a large area of the nursing parent's lap. And that space in the parent's lap is an area that a lot of people actually need to be able to use in order to position their babies for the best possible latch. So if the pillow is there, it can block you from getting the correct positioning. And these two pictures I really like. I took these with a client about 7 years ago, and the picture on the left, you can see the parent nursing with a boppy type of pillow on their lap, and the baby's head becomes turned at an angle, kind of away from the breast. It's no longer in alignment from the breast. The pillow is holding the baby's head up in such a way that it's actually not the correct positioning. If you compare that to the photo on the right, all we did was take the boppy away. You can see it in the background on the sofa behind the baby. All we did was take the baby away. Everything else about the positioning is exactly the same. I just stepped toward the mother and I just removed the pillow for her. Nothing else changes, but you see the angle of the head for the baby is completely different. And the baby is now in the correct alignment for this baby and this mother. The direction that this person's nipples are facing is a downward direction. So the baby needs to come from underneath in order to latch on in the appropriate way. The image that we see on the left did not give us the correct latch, and we just made that one change, and the new mother said it took the pain away. So very simple correction. There's a lot more I could say on this topic. I don't mean to oversimplify it, but I want people to be aware that sometimes it's something as simple as this object, which is blocking the way, and for a lot of people it doesn't work. Even when I look at the picture on the left, I looked at the website for the boppy company. They have a photograph on their homepage of a baby nursing with a boppy. It looks exactly like that. The head is tilted in the wrong direction, and that's the photograph that's being used to advertise the product, but it's actually not achieving the goal that we hope it would achieve, which is easier nursing. So now what I'd like to talk about is what to do if an injury to the breast has already occurred while nursing. If someone is in that position, the first step that we need to do in that situation is to heal the injury. And Valerie spoke to that from her own experience. She used some of these techniques. So if there's been some kind of abrasion, if that may have resulted, after kind of a misplacement of the latch that, that resulted in some, the tissues being hurt a bit, we want to get that healed so that we can go on to have pain-free nursing. And for some people, the cause of their pain is that they experienced something in the early days which never healed. They experienced an injury in the early days of nursing that never healed. And simply by allowing the injury to heal, then we can prevent any further pain for some people, but we've got to let that injury heal. So ways to do that, some of which Valerie mentioned. If you have access to nipple ointment, there's various brands that are available, usually made from lanolin, that are used to soothe the breast tissue. People will often put the ointment onto their nipples after nursing. However, you can also use these ointments before nursing. They're medically safe to enter the baby's mouth, and they can provide a little bit of a barrier that helps the tissues heal. This is temporary. We hope it's going to be a few days. In some cases, it's a few weeks, like Valerie experienced. But that is the use of nipple ointment can be temporarily helpful. It's not meant to be used all the time forever, just in situations where we need some protection or some healing. Next, learn to position the baby so that their latch does not land on the injury. So Valerie talked about that as well. She invented some of her own positions, which is awesome. But again, just studying, if you're always holding your baby, for example, horizontally, actually I can see myself. I was going to demonstrate, but you can't see me. So if you position your baby usually horizontally, you might find that the nipple's getting pinched in a certain spot. And if we can rotate the baby so the baby is now vertical and sitting in your lap, that could allow those areas to heal, because the alignment of the baby's mouth is no longer landing on that injured spot. Or it could be the reverse. Somebody could be holding the baby vertically, and if we rotate the baby to a horizontal position, we can help with that as well. Pumping can be helpful. I've found that it often takes about 48 hours of pumping at a low and gentle setting for some people that allows an injury that happened when the baby's mouth was latched on. It allows those injuries to heal if we temporarily go to pumping. I'd like people to try not to worry that if you, excuse me, that if you were to pump, I don't want people to worry that babies will forget how to nurse at the breast. If we pump temporarily, we can give relief and feed the baby pumped milk by a bottle. And after 24 or 48 hours, you can go, right back to trying out nursing, see if some healing has occurred. You might have to extend your pumping sessions for another day or two beyond that, so that things are healed enough for the baby to come back to the breast. But those of us who've worked in the lactation profession, we've worked with people whose babies received pumped milk in a bottle for weeks before they were able to return to the breast. Maybe it was a baby that was hospitalized in a special situation. Babies do not forget how to nurse, and it's okay to pump for a few days. Milk expression by hand is an option. And when Valerie told her story, I was wishing we had tried that out for her situation. She talked about how massage of the breasts did not hurt her. And so this is related to that. When you learn how to withdraw milk from the breast by hand, rather than with a machine, with a pump, you have full control. And it takes it can take a little bit of time to learn how to do it, but expressing milk by hand can help with the healing process, because you are controlling where your fingers are pressing the milk out from, rather than having the baby or a machine on the breast. Air dry your nipples. That was very helpful for Valerie. And a nipple shield can be used, again, temporarily, just like the nipple ointment, to provide a little bit of a barrier to allow the breast to heal. Then a nipple shield is it's like a silicone nipple that you place over the nipple on your own body, and provides a little bit of a barrier. It's not meant to be used long term as a substitute for correcting the latch. So we still want to correct the latch, even if we use some of these other things that are available to us. Okay, and so other than a latch that is—
Ananda?
Yes.
Tina asked, what about using the haka?
The haka sounds great. So yes, that is a type of pump. It's a silicone, it looks like a small vase. It's not an electric pump. You place it onto the open end of it onto around the nipple area, and you squeeze the vase, and it creates suction and pulls milk out. People have different results with that, so by all means go ahead. Some people find that it works best, most people find it works best if it's used on one breast while the baby is nursing on the other breast. So if somebody had some injured tissues on one breast only, they could nurse on the other breast and see if the haka would work, to give them a break from the baby being latched on to the injured side and using the pump on that side instead. So I'd say give that a try. Yeah.
So she was asking specifically, can you use it as a substitute for a pump?
Yeah, so if
to avoid pain.
Yeah, so if somebody needs to say pump for, let's say, 48 hours to give their their breasts a break from the baby's mouth, it may not work. It often some people have reported that it withdraws milk, but most people need to use it on one breast while the baby is sucking on the other breast. So if it was pumping only for 48 hours and baby's not sucking on one side, a lot of people have found that their body doesn't respond to have a letdown into the pump unless a baby is sucking on one side and the haka is on the other. But you can try it, and I think there are some people who have had success with that. So by all means, give that a try. But it might need to be an electric pump or actually using a hand technique that's designed to get milk out.
And then yeah, I had a question. Sorry to butt in one more time. Is the hand expression as effective? Like, can you get as much milk doing hand expression as you can pumping or having the baby feed? Yes, you can. And some people report that they get more milk from hand expression. And for today's session, I wish I could talk a little bit more about that topic because I'm not totally prepared. I'd need to do some review myself. But I'll mention one resource, which is a video produced by Stanford University, and it's called Maximizing Milk Production with Hands-on Pumping. And that's a 9-minute video, which does show examples of people using their hands to express milk and getting large volumes of milk. And so I'm going to refer to that for now, since I'm not going to be teaching the technique myself for today. But yes, once the technique is learned, it's not always something that's obvious and intuitive, and it helps to have someone show you how to do it. Once it's learned, people have reported that they've gotten more from hand expression than they have from an electric pump. So awesome. That's something, thank you. Yeah, it's something for all of us, me included, to brush up more on that particular technique. And so we're finishing up here. We've just got 2 more slides to go, I believe. So I wanted to talk about possible other sources of pain besides latching itself. First on the list is engorgement, and this is when the breasts become very full with milk, and not only are they full and heavy with milk, but they become overly full, and the breast tissues become irritated because they are overly full. The solution for engorgement is usually to nurse more. There's several issues that can pop up with nursing where the solution is to nurse more, and that's an example. One of the examples is that if we can put the baby to breast more, we can withdraw that milk. Sometimes in response to engorgement, people will pump more. However, we want to be careful with pumping more because that can, sometimes the pumping might go on for a bit too long, and that can just increase the engorgement because we're telling the body to produce more. So if it's possible to get the baby on there, we'd rather have the baby remove the milk with engorgement or use hand expression for that. Mastitis is kind of a progression beyond engorgement, where not only is the breast overly full and irritated, but it can become inflamed, and an infection can also possibly brew in there. Oftentimes that's accompanied by a fever. So that's very heavy, hard breasts, which might be accompanied by other symptoms such as a fever. In case of fever, please head right to the doctor, because that's getting us into a bit more of a serious condition. A blocked duct is a situation where a small area of the breast feels hard and lumpy, and milk is kind of congealing in that area, and there can be a very localized, small, tender, or painful spot. Same thing, one of the solutions for that situation is to nurse more to help milk flow. Thrust or yeast infection is a fungal infection that can occur on the skin of the mother and in the baby's mouth, and that can cause pain for folks.
Some people describe a burning pain inside the breast or an itching on the outside of the breast, as well as pain not just during feedings, but in between feedings. So those kind of symptoms, again, see a medical professional, because we may need to do, we may need to use some medication to get rid of that fungal infection. If the baby has torticollis or birth injuries, that refers to a situation where a baby has usually some tension or cramping in their head and neck muscles that might have occurred during birth or during pregnancy due to the baby's placement in the womb during pregnancy. Sometimes a baby will get a cramped neck, basically. And if a baby seems to be taking on postures that are very stiff, and maybe they might be cocked a little bit to the side, or the head might be tilted back, and there's a lot of tension in the baby that's kind of preventing the baby from relaxing in order to latch. That's something that we can check in with a healthcare provider about. It may or may not affect, it can affect baby's abilities to latch. So I have seen that where a baby is in need of some treatment for this muscle tension, because it is impacting feeding a bit. Raynaud's syndrome happens when a person has the response with a change in temperature that causes the nipples to feel painful. So sometimes people will go, like a breastfeeding parent might go outside in cold weather and all of a sudden their nipples hurt, or a baby can come off the breast and the wet milk that's left behind starts to cause a chill, and then there's pain that goes along with that. That's known as Raynaud's syndrome. Again, make note if you're having any of these symptoms, and what we want you to do is check in with a healthcare professional about most of these issues. Neonatal abstinence syndrome is also known as withdrawal, and that occurs if the person during pregnancy was using certain medications or certain substances. So this could include opioids or methadone. When babies are born, they'll experience neonatal abstinence syndrome. It can also happen if the parent was taking prescription medications such as SSRI antidepressants in the last trimester of pregnancy. And we want people to be treated for depression. We're not asking them to stop their treatment, but just to know that sometimes babies will experience withdrawal in the first days and weeks of life if those medications were used during pregnancy. This also occurs if there was smoking during pregnancy. And when babies experience withdrawal, they exhibit a number of symptoms, including tension in their bodies where their jaws can clamp down and it can feel like they're biting the nursing parent. They don't have teeth, but there's so much tension in the jaw that it feels like there's a vise on the nipple. The solution that I'm familiar with for this is that pumping can be done for about a week or two, and then the baby can return to the breast once they've made it through this period of kind of detoxing. Pumping with a suction that's too strong can create additional pain. So if pumping is happening, we want start at the lowest strength section, not the highest. And then these last three issues, you may have heard the idea that people with very light skin or red hair can experience pain with breastfeeding. There might be some truth to that according to research that's been done. Also, it says here, if someone had a history of low pain tolerance in your lifetime, keep that in mind. Or the last item on the list, sensory processing disorder. If somebody knows that that's a characteristic that they have. These last three items are characteristics that do not cause difficulties with nursing. However, if a person who is nursing is experiencing pain and they simultaneously have one of these characteristics, it's possible that they could feel the pain more strongly. So the pain is not, the nursing problems are not caused by red hair or your pain tolerance. So even somebody who has a really low pain tolerance, like I do, that's okay. We want to get the latch corrected. We want to get any other issue that's going on corrected, because someone, you know, like myself or with one of these characteristics can experience intensified pain, even though the characteristic in itself is not what's causing the latch problem or one of the other issues. So what we'd like folks to do in any of these cases, these are, again, there's some things on the list on this screen which should be screened by a healthcare professional. When we talked earlier about latching, we want people to get support, hopefully from a lactation specialist or from a breastfeeding support group such as La Leche League or Baby Cafe. Those are both in organizations that are found nationally in the US, and there are also some chapters outside of the US as well. And we do want folks to get help. So on your own, you can use micro adjustments. You can study what latching looks like. You can do meditations and relaxation exercises when you're not nursing. Hold your baby in new positions that you might use when you are actually feeding, but separate it out from feeding itself so that you can just relax and hold your baby and notice, like, where's my baby's mouth placed? Is my baby's mouth kind of too high up on my chest, something that would work better for bottle feeding, but for breastfeeding, I actually need to move the baby downward, down below my breast, below the nipple. Kind of, you can have an awareness of that at moments that you are not actually nursing, and go into that meditative state, and then carry that over into your feeding sessions. And at the same time, just know that there are resources available to help folks either with professional help or in a support group setting. And this is important. And as Valerie talked about, reaching out can be necessary, and self-advocacy can be necessary. And what happens here in the US with our healthcare system is that for when people give birth in hospitals, or I should say during pregnancy up until the time of giving birth in a hospital, the pregnant person is being cared for by an obstetrician or a midwife. But once the baby's born, those professionals kind of fade out of the picture. And now the new parents bring their baby to see a pediatrician. However, there's no one looking after the nursing parent anymore. So we've really got a large gap in terms of making sure that someone is still supporting the mother after she gives birth, and that she's not just discharged into into the wilderness, which is unfortunately how we approach it right now. So we want people to know that there's a lot of work we need to do to make that help available, but it is out there, and we want to get it out to more people. So here are some ways to find help. You can start with your doctor, your midwife, or your primary care provider, and ask if they might not have training in lactation. Surprisingly, there are OBs and midwives who do not have training in lactation. Quite a few of them don't have formal training, but they could refer you to a lactation specialist. There's some other professionals on there that I've listed. Sometimes it helps to have a baby seen by an ear, nose, throat doctor to look for structural issues in the baby's mouth, or again, kind of the entire structure of the head, neck, and shoulders, to see if there's some tension that needs to be released. So that might happen in the office of a pediatric ear, nose, and throat doctor. So kind of starting with your primary care doctor or your baby's primary care doctor, which is the pediatrician, they might refer you to a specialist like that. You can search for a lactation counselor or a lactation consultant in your community. So we've got some ways to do that here. You can contact us here at Boston Doula Circle. There are other body workers who can sometimes be helpful, again, for the infants. So there are chiropractors who have a pediatric specialty, and a body worker called a craniosacral therapist. And these are professionals who work with babies who are struggling to latch. And then the support groups that I mentioned, La Leche League and the Baby Cafe, are wonderful resources that can be found in communities around the country. They traditionally have had in-person meetings that you can go to. Right now, a lot of their work is being done online, but it's still a place to go. And like Valerie said, you know, if you can talk through your symptoms with another person, that's really the first step in getting things resolved. And some of this you'll be able to do on your own. Some of this, it would be helpful to have support. So we're gonna end here. I'm going to actually show my face again. I just want to say thank you to everyone for being here. Our hope is to continue offering these sessions throughout the year. So we're kind of evolving our programming right now, and some of our sessions are going to be similar to the format we did today, with some lecture and mind-body meditations. And we're also hoping to have sessions that are more interactive, where people will be able to speak together, and we're working out how to get that set up. My dream would be to have this happen at least twice a month. And we're so happy to, you know, have you join us and to explore these issues with us.